Hello, hello, we're live.
Hi.
We only have 15 minutes, so it's going to be quick, and we have a lot to cover. So, no
Yes.
getting off track and discussing the day. We can easily do 15 minutes on.
Is that possible?
Stay on track. No talking about Amanda Gorman.
Okay. Well, well, if we okay, then can we do a breath of release then
Yeah,
for because
that feels good. I did a lot of breathing and gasping throughout the day.
yeah.
It feels really good just to, whoo,
Yes.
whoo.
Yes.
Amanda Gorman, by the way.
Yes.
Shameless, not shameless,
Yeah.
proud
Yeah.
plug for Amanda
Yeah.
Gorman.
And I mean, too many amazing things from today, but to even begin with that, and especially with our constraint of time, but um, just the day itself.
hmm Yeah, it's a new day. We see so many women and trans folks and minoritized people stepping into really important roles,
Hmm.
um, and that feels really good.
It
That
feels really good.
feels good.
It feels really good to have this sense of hope and excitement and joy and pride, and it feels good to feel good,
Mm,
and this year itself has been a year where many of us haven't been able to feel good. And these last 4 years have definitely been a time where a lot of us just have not had this feeling. And so to have it again, understanding all of the challenges that we face as a country and as a world, to be able to start from a position of triumph and say we will be able to conquer it. At least we will give it our tribe. We're going to be a collective again. We have those hopes to be. It's just amazing. It's amazing. So
so, did you get to catch any of it today? You were busy working.
I worked, but I caught it. And I was able to broadcast it in the office. So for the patients that came in, they were able to enjoy it. I broadcasted it in some of my exam rooms. I had one patient in particular when they were about to do the swearing in. And I wanted to watch it. I asked her if she wanted to watch it. She said yes. And so I brought my laptop in and we watched it while talking.
Women can
And so
multitask.
yeah, we multitasked. We watched it. We cried. We shared our life stories with one another. We discussed her hormone replacement therapy and did her exam. So,
And that's not the only time that you've had a woman multitasking this week. Is that right?
oh no, that's very true. I also had another patient, and I've asked if I could share their stories, so I have permission from both women. Um, I had another patient this week who was in a virtual meeting during her visit and also during her exam, which I did not mind and do not mind at all. So that definitely means there is no excuse. You have time because I will allow you to take a meeting while we do your exam, while you get yourself right, get yourself checked, and not miss a beat. So yeah.
So that's a good pivot onto self-care. So no excuse to not do self-care. And part of that
Exactly.
self-care is the yearly, and part of that yearly is a pap smear. And until we were prepping for this, I don't know what happens. It's kind of like the dentist. I just have this imagination of what happens, but what goes on in a pap
Yeah.
smear?
So that actually is a very good question, and I think it's uh, a question that's easy to answer, but I think many women oftentimes are kind of scared to ask it because maybe it sounds a little bit too simple. Maybe we think we should know what it is, and but there's no problem with asking, the simple questions. And so a Pap smear is basically an exam of the cervix, a cytological exam of the cervix, and the purpose of it is to screen for cervical cancer. It's a cervical cancer screening test, and cervical cancer around the world is the leading. one of the leading or the leading gynecological cancer, but in this country, it's not. And that's because of pap smears. And so, simply putting a speculum into the vagina is not a pap smear, that's a vaginal exam. Simply swabbing the cervix itself is not necessarily a pap smear because there are many other things we can do and test for with swabs. But taking a swab and doing a certain process, lab process, to evaluate the cells of the cervix, that's a pap smear. And so, what's the cervix? Maybe that's also where we start. So let's begin at the beginning. So the cervix, I brought models because it's easier to explain.
One.
So this is the uterus, everyone. Um,
It is cool.
and the cervix is a part of the uterus, and it's the part of the uterus that enters into the vagina. And so it's the entrance into the uterus, and there are different cells or different areas of the cervix that kind of can change rapidly over time, and that's where cancers can occur. Just to be complete, this is the body of the uterus up here. These are the fallopian tubes, and then these are the ovaries. And so when we're doing a pap smear, a speculum is put into the vagina. That's usually the most uncomfortable part, but it's really to open up so we can see this little divot on the end of the cervix to visualize it. And then we take cyto brushes and a spatula and just take a swab of this area to evaluate the area that I was talking about where there's that rapid change for changes.
And what role does HPV and the vaccine play in cervical cancer?
Well, that's another good question. So HPV stands for human papillomavirus, and it is the virus that is responsible for most abnormal pap smears, most cervical cancers. There are many different types of human papillomaviruses. HPV can be active in other areas of the body or can affect other areas of the body. But for women, obviously, we are concerned about the cervix. And so there are two different types of HPV that we're most concerned about, 16 and 18. That's because they cause most of the cervical cancers. And so when you're having a pap smear, I like to think of a pap smear as with two different parts. One part that evaluates the cells, that's what we talked about with the cervix, and the other part that evaluates to see if you do or you don't have HPV. And so, HPV is a very common infection, very common virus, and we generally do not necessarily evaluate for HPV in younger groups right off when we're doing a pap smear. We're really looking at the cells of the cervix to see if there's any changes that we need to be concerned about. And that's really because most people who have had sex or any sexual contact would have come into contact with HPV at some point. And so because it's one, easily transmitted, and two, can be easily resolved by your immune system, in young women, we don't necessarily check for it when we're doing a pap smear initially. Now, if there's some type of abnormality with the pap smear, okay, you should have an HPV test will then be done or should be done by the laboratory or the lab. And then, you would have afterwards fall into a certain category for how your follow-up should be. And when we talk about those categories, we really think about women in different groups, 21 to 24, 25 to 29, and then over the age of 30. Those women over the age of 30 should definitely have an HPV test along with their pap smear, and that's called a co-test.
And what age do people need to start getting the HPV vaccine if they're going to get it?
So the vaccine in the last few years, the age range has expanded. And so it's age 9 to 45 now, actually.
9.
Yeah,
And
because
that is
more studies started to show that women after 26 did receive some benefit in getting the HPV vaccine. And it's not just for women. Men should be getting it too. Young boys should be getting it too. The earlier you get it, the younger you are, especially if you've not had any type of sexual contact. And that's why it really, children should be getting it. If you have not had any sexual contact, you have a higher chance of creating a more robust immunity against HPV.
And is that part of a normal visit with a pediatrician, or is that something that people need to advocate for?
So HPV should be part of the normal vaccine schedule. But obviously, parents can choose what they vaccinate their children for and what they don't vaccinate their children for. Pediatricians are, in more recent years, encouraging patients or parents to vaccinate their children against HPV. Gynecologists and obstetricians too should be discussing it with their young patients, obviously now even the patients up to 45 can get the vaccine. So it should be discussed in an annual visit and a normal visit. But patients should always still be their own advocates. And so, yeah, I do recommend advocating for the vaccine, even if you're in your 40s.
Okay. So I saw on the World Health Organization website about this, that cervical cancer, and is this correct? Cervical cancer could be eradicated within 1 generation?
Mm-hmm. Yeah, if you think about how the vaccine works, and so we talk about even with this coronavirus vaccine, you vaccinate enough people, but for HPV, you have to think about both sides of the coin. It has to be men and women. It can't just be women. We're not responsible for the health of everyone. We're responsible for our own health.
Stop right there.
So, but yeah, if the vaccine and, again, not only vaccine, but screening too. That's why we in this country have that benefit, because of the screening. It's a powerful screening tool when used appropriately and correctly.
So right now, I remember there was a period at the beginning of the pandemic where I was putting off a bunch of my appointments that were kind of like yearly things like that. I thought that can wait. But the pandemic is dragging on for quite some time. We don't want to, at the risk of something else, we don't want to kick in too far down the road that we then skip the things that would keep us healthy in the long term.
Yeah. The great thing about having a co-test, or really understanding how HPV works, or if you're even a practitioner that does HPV screening without cytology in your young women, or even older women. The wonderful thing about understanding how HPV works is that you will also understand the screening time is longer. So you don't necessarily need PAPs every year if you have normal PAPs, if you're a low risk person, low risk for having a chronic HPV, low risk for having a cervical cancer due to that. So it's every 3 years for women under the age of 30, and every 5 years for women over the age of 30.
Okay.
Definitely, we do encourage having more frequent exams. When we talk about Pap smear screening specifically, that's the range.
There's a joke from The Office where Michael Scott says, "Is it Pap smear or Pap schmear?" And I can't through it. I'm sorry to bring it down to that level. And I shouldn't be the only one in charge of asking questions, because things like that joke are popping in my head. So what we want to know is, listeners, people watching, what questions do you have? You can send them to us in a direct message if they at all feel embarrassing, or you can drop a comment down. These likes and shares help to get this information out to more people. So if you have questions and we don't cover it in this video, and you didn't happen to tune in exactly the right time, we're trying to make this a regular thing. So feel free to drop those questions down and we can hit it in an upcoming episode.
Yep. Thank you. Knowledge is power, and a question is only answered if it's asked. So ask any question.
And each time you visit these conversations, I'll just speak for myself. Each time I visit these conversations, I get less and less embarrassed about them. And I don't think that I don't specifically ever feel like that was handed down to me, but there is a societal sort of shame or embarrassment around things that happen in that area. So the more comfortable we get, then the more comfortable we get.
Yeah, yeah. You're right. You're right. You're right.
Great. So we are going to end it there. Thanks for tuning in tonight, and we will see you guys all next week.
Thanks.